Welcome, everyone. Bienvenidos. My name is Liza de Jesus. I am the director of the NJ4S Campus Monmouth program under Preferred Behavioral Health Group. Thank you for joining us. We want to start on time. We want to respect everyone's time that have joined us today. Mi nombre es Liza de Jesus y yo soy la directora del programa NJ4S Campus en el condado de Monmouth. Campus Academy is a webinar series that exists to help support youth and their families by sharing prevention and mental wellness educational information with adults so we can learn from each other. Campus Academy son seminarios que existen para ayudar y apoyar a los jóvenes y sus familias. Estamos compartiendo información educativa sobre prevención y el bienestar mental con adultos. Podemos aprender uno del otro. If you prefer this presentation be transcribed in another language, please check the chat. There are instructions on how to do this within the chat. Si prefieres esta presentación en español o en otro idioma, por favor, sigues las instrucciones en el chat. ¿Cómo hacer esto? NJ4S, the New Jersey statewide Student Support Services Program, was launched last year by the Department of Children and Families to meet the needs of students and their families through prevention and mental wellness programs and resources. This month, Campus Academy has 2 webinars scheduled. Today, Linda and Corey will specifically present on prescription drug misuse and fentanyl. And next Wednesday on January 31st, we usually have one a month, but we have 2 this month. We were lucky. Next Wednesday on January 31st, Linda and Corey will be presenting on bullying and cyberbullying, the prevention of bullying and cyberbullying. So please stay on after their presentation to learn more about when that presentation or how to register for that presentation, but also to learn more about Campus and how you can get in touch with us if need be. Today's webinar is a continuation of last month's, a deep dive into substances. Since we only have an hour, I want to ensure everyone we give our speakers enough time to present the information and give all of you enough time to ask questions if need be. So I would like to introduce Dr. Linda Richter and Corey Hammond from Partnership to End Addiction.
Awesome. If you want to, there we go. I can share my slides. All right. Thank you so much for the intro, Liza, and thank you so much for having us again. As Liza said, this is a continuation of our presentation from last month where we talked about alcohol, nicotine vaping, and marijuana. And so today we're going to be talking about prescription drugs and fentanyl. Again, if you haven't seen us before, thanks so much for being here. And we are the prevention team at Partnership to End Addiction. I am Corey Hammond. I'm the Director of Prevention Services, and I'm joined by my colleague, Dr. Linda Richter, who is the Senior VP of Prevention Research and Analysis. And then we also have a research assistant, Olivia Root, who helps us put together all of this. So what we're going to go over today is we're going to talk about prescription drugs, prevalence and trends, what misuse means, some concepts and definitions, why young people might be tempted to use prescription drugs, and what consequences of that might look like. And then Linda's going to go into fentanyl and talk about what that is and why we're concerned about it. We're going to give you some safeguarding tips for how to keep kids safe and how to talk about these things. We'll talk about harm reduction quickly at the end, and then give you some of Partnership's resources if you're looking for more information, and hopefully have time for some Q&A at the end. So jumping right into it, prescription drugs, background and concepts. Throughout this, you're going to hear us talk about misuse and prescription drug misuse. And so what does that mean? This means using a medication in a way that is not prescribed to that person by their own health provider. So this can be a variety of things. This means you have a prescription, but you're using more of it than you've been prescribed. You have a prescription, but you're using it past the time period for which it was prescribed. You have a prescription, but you are using that drug in a way that it's not prescribed, or you are using someone else's prescription or a drug that was not prescribed to you. And so this is common in situations where someone's trying to self-medicate, difficult emotions, mental health problems, an injury that they can't get proper care for, or to counterbalance the effect of other substances like alcohol or other drugs. They often kind of go together. And so what are the substances that are constantly or commonly misused? The prescription drugs that are commonly misused are those that alter our moods, our emotions, our perception, and often affect our sense of calm, our happiness, or the amount of energy that we have. And so you've probably heard of most of these. The first class of this would be prescription pain relievers or opioids. So these would be things like Vicodin, OxyContin, hydrocodone, the painkillers that are prescribed by a doctor. And then we have things that you might have heard of that are called benzos, benzodiazepines, tranquilizers, or sedatives. These are things like Xanax, Valium, sleeping pills like Ambien. And then kind of on the other side of that spectrum, we have stimulants, such as those that are often prescribed to help with ADHD or ADD. So things like Adderall or Ritalin. And so we'll talk a lot about these, and we'll spend some special time talking about opioids. And so these substances are called controlled substances. And what that means is that they have a high potential for misuse. They involve a much higher level of regulation by the federal government when it comes to prescribing and getting them from a pharmacy. And that's because these medications, even though they are therapeutic for many people and in many ways, there is a level of risk of misuse and addiction. So these can be addictive substances, despite those kind of good effects that they have for people for which they're prescribed. And so like when it comes to opioid painkillers, for instance, like the CDC strongly recommends against prescribing opioid pain relievers for the long-term treatment of chronic pain. So they're prescribed for short-term, but long-term, CDC strongly advises against it because they are so addictive. And so when we're talking about youth, this is so important because the use of prescription medication by youth, young people are particularly susceptible to addiction, more so than adults. So those risks for misuse and addiction for these pills for adults are even higher when it comes to young people. Quick semantic definitions here. I'll be talking a lot about opioids, and you might also have heard of opiates and kind of wondering what the difference is here. A lot of people will use these interchangeably, but they are technically different. So opioid is like the larger umbrella term for all of these substances, whether they're natural, whether they're synthesized in a lab, all of them are opioids. Opiates is a smaller class of just those that are all natural coming from the opium plant. So all natural opiates are things like heroin, morphine, and codeine. And then some of the ones that are synthesized in a lab that are synthetic or semi-synthetic would be things like OxyContin, hydrocodone, fentanyl. And so it's not a vitally important distinction because they act the same way. And obviously an opiate, even though it's natural, it's not like heroin is better for you than any of these. So they're all kind of equally dangerous, but we'll be using the term opioids moving forward to talk about all of these as a class. This table has a lot in it, and so I'm not going to go through it, but I'll make sure that we send the slides out. So if you want to look at this in greater detail, you can. This goes through categories of drugs with examples of kind of the legal prescriptive names, as well as a similar drug that in a legal class that works in a similar way. So things like opioid pain relievers, you can get prescriptions for some of those, but they work the same way in the brain as heroin does because they're the same class of substances. Similarly, stimulants, things like Ritalin and Adderall, they focus your attention, they heighten your alertness, and they work similarly in the brain as cocaine. And it also has reasons for why someone may misuse some of these substances. And, this is important to know because 2/3 of the people who are coming into treatment centers seeking treatment for an opioid addiction report that they began their opioid use with pills that were prescribed to them, things like oxycodone and hydrocodone, as well as 50 to 75% of people who are using heroin started by using opioid pills. So understanding that these substances are very similar in cases and why people might misuse them, we're all about trying to prevent that. Some prevalence and trends when it comes to prescription drug use. This is lifetime and past year use of different substances among 12th graders, so high school seniors. About a little over 12% of seniors had ever used any illicit drug other than marijuana, but about 8.5% of 12th graders had used any prescription drugs in their lifetime. And you'll see that a big chunk of that is ADHD medication, which makes sense because that's something that is diagnosed pretty frequently. And there was no past year data for ADHD medication, but about 7% of high school seniors had used ADHD medication in the past 30 days. So we're kind of current users of these things. So while we talk about this, and it is very serious, it is important to realize that not all students are using these. It's actually, a fairly low number are using these drugs, but, it is still a very important topic. The misuse of prescribed medication. So about 35% of young people, 12 to 25, had taken a prescribed psychoactive drug in the past year. And so psychoactive drug, that means any drug that changes the function of your nervous system or alters your perception of your mood. So this includes everything that I've mentioned: ADHD medication, benzos, like antidepressants or antipsychotic medications, as well as painkillers, but it doesn't include things that like an antibiotic that you're prescribed. So, just looking at this, 35% of students or 12 to 25-year-olds having been prescribed a medication is not inherently problematic. But then in purple, you'll see about 1/3 of those misused that prescription drug. And so that's really what is important here. Almost 20% of teenagers who were prescribed an opioid in the past year, or about 20% were prescribed an opioid, and almost 20% of those kids misused the opioid. So that's either taking too much of it, taking it past the time period. And then similarly for kind of the older kids, 18 to 25, 30% of young adults in that range were prescribed an opioid in the past year, and 23% of those misused the opioid. So it's really important for all of us to know that of those who are prescribed these medications, a good chunk of them will use them outside of the way that they're prescribed. But again, what we always love to kind of center around is the fact that most teens are not using things. A lot of kids are what we call lifetime abstainers and are not using substances. In this past year, in 2023, 70% of 8th graders, about 55% of 10th graders, and about 38% of seniors were lifetime abstainers and had never touched anything. So, we're not talking about the majority of kids when we're talking about this. But for those who are getting prescription opioids, how do they get them? You'll see that about 50% get them from a friend or a relative. But then in the younger teens, for those 12 to 17, about 40% of them were prescribed it. And then when it comes to buying from either a drug dealer or a stranger, you'll see that's a little more common in those who are older, 18 to 25 on the far right there, but still about 10% of teens, if they're getting a prescription opioid, got it from a stranger or bought it from a drug dealer. And so this is important because the vast majority are getting, or about the majority are getting them from friends and relatives, and a large percentage are being prescribed them themselves. And so when we're talking about getting substances from friends and relatives or buying them from a dealer or a stranger, we run the risk of counterfeit pills. And so traffickers and dealers, they may cut their drugs with other substances to extend their supply, and be able to charge more for less of their actual supply. Some pills can be cut with all sorts of different things, flour, chalk, to more dangerous things like heroin or fentanyl. And these illicit drug supplies are obviously, they're not regulated. So it's very difficult for anyone to know for sure what it is that they're taking when they get it in this kind of situation. And so, you know, even if a person who is giving somebody a substance is like a friend or an acquaintance or somebody at school, and they don't think that someone is trying to harm them, you know, someone who is selling substances like this might not realize exactly what is in the drugs that they're selling. Some kids might think that they can trust their friend who's dealing them drugs, but that kid might be getting the pills from a couple lines down the dealer train, who is not a trustworthy person. And Linda is going to take over this section on why young people misuse prescription drugs.
Yeah, thank you, Corey. Yeah, so I just want to cover a couple of highlights here that, you know, a lot of this overlaps with why kids misuse any substance that we don't want them misusing, whether it's, you know, vaping, alcohol, marijuana, or other illicit drugs. But there are some unique things about prescription medications that could lead some young people to seek them out or misuse them. Go to the next slide. So one key thing is social pressures. And I just like to highlight here, and obviously there's no uniform across the board way of thinking about this, but, you know, parents and older generations often think of social pressures as sort of the old time peer pressure where, you know, there's a bunch of kids hanging around and someone's sort of trying to push a substance on them, whether it's marijuana or a pill, and make them feel like a loser or bad if they don't partake. Certainly that happens. I'm not saying it's impossible, but typically nowadays when kids talk about the pressures that they feel to misuse any substance, but especially prescription meds, it's not so much this sort of direct pressure and sort of a piling on by the friends. It's often just that's kind of what they think everyone around them who is in their peer group is doing, that it's the norm, that it's the kind of usual thing to do. And the last thing kids want to do is be different from their friends. Like, you know, conformity is a bad word to us, but it is really the ideal for kids in a way, even though they don't admit to it. They don't want to stand out. They don't want to be different. So it might just be normalized or perceived as normalized in their setting. And that perception is actually more important for understanding motivations for use than the reality. So as Corey just said, you know, the majority of kids are not doing this by any stretch. In fact, when you look at prescription drug misuse and illicit drug misuse among young people, the numbers are really quite small overall. So the vast majority of kids are not doing this, but it's this perception that everyone's doing something that really motivates young people to be part of that crowd and do the same. So it's that perception that's important. And this kind of wanting to fit in, and especially in these more social situations like a party or a hangout where this might be going on. There's also a lot of misinformation around a drug's effects or benefits and their relative safety. So the misperceptions around their benefits or positive effects come from the fact that they're prescription drugs, right? Like there's something inherent about that this is something that a doctor is prescribing to people. Clearly it has benefits and can't be that harmful, right? Because why would doctors prescribe something that's going to really hurt you? So there's this sort of aura of safety around most prescription medications. And in fact, a lot of kids either themselves are prescribed medications like these or have family members or friends who have been prescribed them. So it's sort of, again, part of this normalization of these medications and this understanding that they can't possibly be that dangerous. And a lot of the information that kids get about them, just go back for one more second, Corey, please, is, that is not from reliable sources. So they're hearing a lot about, the benefits from friends or from social media or from influencers, and not from reliable sources that really kind of go through the nuance of how they could be harmful. Okay, you can go to the next one. So another thing that you'll, I'm sure, hear quite a lot, especially when it comes to stimulant medications, which are most commonly known as, ADHD medications, are that they can help enhance your performance, whether it's academic performance or athletic performance. And that's because they are stimulants. They boost your attention. They kind of allow you to have sustained attention. They do that in a very, medically effective way for kids who have a problem with that naturally. But think about cocaine, think about nicotine, think about caffeine. Those are all stimulants, and those are all things that people take to kind of focus and concentrate and boost attention. So clearly there's some understanding that that's going to help if a young person has to stay up and study for a test, or kind of tackle 5 different things that they're trying to do to accomplish in a day. So a lot of kids might turn to prescription stimulants in particular to kind of boost that sort of performance. And the fact is that while these medications might actually boost the academic or athletic performance and sustain attention and all that, they will only do so for a short time period, because as we've discussed in other presentations, and as is true of every substance that is misused and has effects on the brain, over time, the effect wears off. And in fact, there's sort of a boomerang effect where you kind of get the opposite effect than what you kind of were going for in the beginning. And it becomes harder to sustain attention, or you go through withdrawal when you don't have the substance. And it sort of throws the brain chemistry off balance, so that you really either have to very much rely on using this and increase the dosage over time. You build tolerance, you have withdrawal without it. So all those symptoms of addiction kick in, and the effects kind of diminish over time. So this one is really critical when it comes to prescription drug misuse, and is so important, especially today, as we're all so concerned about youth mental health, and for good reason. So many young people who do misuse prescription medications do it to self-medicate. Either their mental health problems, stressors, are not being adequately treated, whether it's through therapy, prescribed medications, or just getting the attention that they need about those issues, or they're inadequately treated. So they may be getting some sort of treatment, but it's not the right kind, or it's not the right amount. So a lot of kids nowadays, as we talk about all the time, are reporting, very high rates of feelings of anxiety and depression and stress. And so they may seek these medications out to kind of alleviate those symptoms. And the problem is that which we could talk about more in a minute, when a young person self-medicates, it could really lead to the emergence of something called a co-occurring disorder, which is when the person develops has not just a mental health disorder, but then develops a substance use disorder on top of it. And those two kind of feed into each other. And that could be either because the use of the substance triggers this underlying susceptibility to a substance use disorder or addiction, or once the person becomes dependent on the medication, then the addiction evolves. And a recent study just found that 41% of adolescents, and this is more on sort of an opioid overdose topic, which we'll get to in a minute. So this is not, I'm not talking about ADHD medications here, but about 41% of adolescents who died of an overdose in the past couple of years had a known mental health problem or a history of receiving mental health treatment. Some sort of mental health care. So, it's really very prevalent among kids who misuse prescription medication. And then there's the sort of parent caregiver tone or attitude around prescription medications. So we know from research that young people are more likely to misuse these drugs if their parents are very lenient about substance use generally, but specifically about prescription medication. So that could be anything from modeling using it themselves in sort of a casual, offhanded way, like, oh, I'm so stressed out, I got to take my pills, or, just sort of just having a very lax attitude around these medications. But even if you think back, and we'll talk about this a little bit more later, in how you kind of set the tone around the whole notion of taking medications when you're not feeling well or when something feels off, even for young children, it kind of starts to set the tone that, like, there's a pill for every ill, or just anytime there's some sense of discomfort, or, not, or feeling slightly sick, that the medication is right there to be taken to solve the problem. And, that's a whole big conversation we can have about resilience and finding good ways to cope and healthier, approaches to negative feelings. But while we're certainly not anti-medication at all, it's just if there's sort of a tone in the family or in the environment that that's the go-to whenever you're feeling off a little bit, that message gets through to kids over time and can, increase the risk later on that when they are feeling sort of out of sorts, that they do turn to a prescription medication, even if it's not their own, in order to self-medicate. So that's sort of the parent messaging around it, and the climate in the home. And it's also really important to realize that, kids know about this stuff, and they hear from their friends and from, the media about some of the benefits of misusing these prescription medications, or the perceived benefits. So the best thing to do is to not have easy access to it in the home. It's sort of, I mean, I don't mean to equate it to a firearm, but, like, that's not having easy access is a real major protector for young people. So if you do have prescription medications that are psychoactive in the home, the kinds that Corey was just mentioning, they really need to be stored and locked away and out of sight and out of reach of young people, certainly young children, for whom we're seeing like really high rates of accidental ingestion and overdose and all sorts of horrible health consequences. So those are little kids just putting them in their mouth because they think they're candy or something else. But even more so among teenagers and young adults who are purposefully taking these medications for the reasons we just discussed. And if that barrier is there, that they cannot access it and they have to jump through hurdles to get it, the risk of their misusing them is going to go down. And then obviously it's what we always talk about, which is that if parents are sort of hoping this doesn't happen without having the conversations with their kids about the realities of prescription medication misuse and what the problems are around them, and why, because how much parents love their kids and care about their health and safety, they really want to protect them from it, those kids are at higher risk of misusing as well. So just like sort of a summary, and this list is really pretty similar to the list of major risk factors for other forms of substance use among young people, is, if you have a family history of substance use or addiction, it is really important to talk to children about it. They need to know that they're at higher risk than their peers. And the reason for that is because kids will turn to you when you tell them, oh, this is dangerous, you can get addicted, and say, really? Because my friend Mark and Joe and Sasha and Alice, they all are straight A students and on this team and that team, and they're taking these pills all the time and they are totally fine. There is no negative effects happening there and they're not getting addicted. And that might be true. It might be true for now. Those things might change down the line, or they might not change, because not everybody who misuses a substance gets addicted. But we do know that there are certain factors that increase your risk of addiction that are not always visible or knowable or predictable. So you may have a particular genetic susceptibility to addiction, or something in the structure of your brain, literally the function and structure of the brain could put you at higher risk of addiction. And unless, we're diving deep into people's brains, literally, we're not going to know necessarily if one individual has that higher risk or not. One thing we do know is that if there is a family history, meaning parents, grandparents, aunts, uncles, if it's in the family, then the child is at higher risk. And that's just a nice way an effective way to talk to a young person about it and say, I'm not claiming that everybody who uses a drug is going to become addicted to it. Because again, we never want to be alarmist and sort of exaggerating these things with our kids. But the reality is that we don't know. It's not easy to know who is and who isn't at higher risk, except if there's this family history. And I do know that we have that history, and therefore you actually do have to be a little bit more careful, or a lot more careful than some of your peers. So it's sort of like a really fact-based conversation you can have about it. So I did want to emphasize that. And then the others, the earlier age at which someone uses any substance, the higher their risk of developing an addiction to it. That's true across the board. We're not going to show you that same slide we always show you, but it's basically very clearly like this upward slope of the earlier you use, the higher the risk. Exposure to any kind of trauma in a child's life, adverse childhood experiences, those are significant predictors of not just substance misuse, but addiction as well. Any kind of mental health or behavioral health problem, as we discussed, is a significant risk of developing dependence or addiction to prescription medications. And then there's those kids who are totally fine, don't have any of these risk factors, no family history, and they are prescribed typically pain medications to treat a pain-related injury, usually through sports or through a common dental procedure like having their wisdom teeth out. And lo and behold, that just literally taking that medication that was prescribed for them, but taking it maybe for too long, or we didn't know that the child has some underlying susceptibility, that child could develop a substance use disorder based just on that. So there's countless stories of this as the opioid epidemic and crisis has unfolded, of perfectly fine kids with no history and no reason for concern who were just prescribed these medications, and over time they developed an addiction to it. Turns out, for the most part, there probably was some underlying risk factor, but those were probably not easy to tell or detect, and that does happen sometimes as well. So what are some of the consequences of young people misusing these prescription medications? So as is true of any type of substance use, any type of psychoactive substance, which as Corey described is something that affects the brain, it actually causes damage to critical brain functions and critical functioning that is so important, especially during adolescence. Decision-making, memory, learning, attention, developing all those higher order skills that people need to kind of mature and develop and become high functioning adults. And it all happens during adolescence, which is the most intense period of brain development. We say it over and over again, but adolescence and very early adulthood is when the brain is undergoing its most intense and critical stage of change and development. So there's two periods when a kid's brains are going through these kind of changes: 0 to 3, which we've all heard about a lot, and then adolescence. Typically the number is up to age 25, your brain's still developing. Your brain continues to develop past that, but that's the critical age. And unfortunately, and for good reason, that's also when a lot of young people experiment with these substances. And so that combination is really dangerous. We know that it impairs mental health, as we said. There's numerous studies showing that when a young person is misusing prescription medications, they're likely to be misusing other substances. Polysubstance use, or the use of more than one type of substance, is extremely common among young people. So if your child is, I'm just using this ADHD med, don't worry about me, chances are they are using other things as well. We know it could lead to addiction. And then there's the whole problem and concern about some of these prescription pills that are accessed not through a legitimate doctor and pharmacy, can be laced with other drugs that are even more dangerous and deadly. And then there are the legal consequences. It is patently illegal to use a prescription medication that wasn't prescribed for you, to use someone else's prescription medication, even if it's your sister's or your mom's or your best friend's. Definitely to give your prescription medication to someone else. All of those things are illegal. So if that's the argument that's going to work with your kids, or that's the perspective that is going to convince your child to maybe think twice, then that is a legitimate one to use as well. In terms of their actual effects of these key controlled substances that Corey was mentioning, it's just kind of good to know what they are. And this is true whether you're using these legitimately or not. These are just the actual face value effect of these substances. So opioids can cause fatigue, it can cause digestive problems, it certainly can cause breathing difficulties. Stimulants of any kind, if they're not used appropriately, usually it can lead to feelings of paranoia, it increases body temperature, it increases heartbeat. These are just some of the things that happen. Depressants, obviously, if you listen to the sound of that word, it can cause slurred speech, slowing down of sort of a lot of the body functioning, so shallow breathing, fatigue or sleepiness, disorientation, lack of coordination. So substances that do that, you're going to have, sort of lower functioning essentially. And at higher doses, most of these can lead to overdose and death, especially when they are combined with other substances like alcohol or other drugs, which again is a very common thing among young people who misuse these prescription medications. So what happens is if you mix prescription drugs with other substances like alcohol or marijuana or cocaine or heroin or any other illicit substance, the effects are going to just be exacerbated and compounded. So some of the common effects of doing it are like an altered mental state, physiological consequences like vomiting and high blood pressure, or low blood pressure, depending on the substance. There's damage to the heart and liver. But combining them really has some very serious detrimental effects, or can, such as a stroke, a heart attack, and this is in young people as well, liver failure, bleeding, brain damage, all sorts of horrible things. And what we do know is that all these high rates of opioid overdose reports that we're seeing, most often when they take a look at the particular case of the death, we find that stimulants or benzodiazepines are commonly also present in the young person's system, in addition to the opioid that may have been the immediate cause of death. So again, this notion that when a kid is using one type of substance or prescription medication outside of their prescribed use, they're likely using others as well. So I'm just going to talk really briefly about fentanyl here because it is such an important topic and clearly something that's on all of our minds as parents. So fentanyl is essentially an opioid, which again is like a painkiller, but it is synthetic. It is made in a lab. It does not come from a natural source. We know that it's about 50 times more potent than heroin, 100 times more potent than morphine. It does have medical uses, and that's how it started. It's something that doctors will prescribe. It's something that doctors will use during, a surgery. There are certain clinical versions of it that are used for medical use. They come in very different forms, and they're essentially used as a treatment for pretty severe pain or pain after surgery, and in some cases, chronic pain. But increasingly, they're being used illicitly as well outside of the medical arena. They're found in many different forms, powders, mixed with, other street drugs, and sometimes as a liquid as well. So why are we so concerned about fentanyl? So we're hearing a lot about fentanyl lately for good reason. It is, as I said, a very strong opioid. And the reason that it's out there is because when you produce a drug in a lab, it's much cheaper to produce than having to go to a farm in some far off country and cultivate the plants, et cetera, and go through the extraction process. It is very cheap to produce fentanyl. And what drug traffickers or traffickers do is they mix the fentanyl in with other drugs that are typically more expensive so that they could sell the buyer the same amount of the product, charge the same amount, and therefore make more profit off of it because there's less of the expensive drug in there and more of this kind of filler of the cheaper fentanyl drug. Over the past decade or more, fentanyl has really significantly infiltrated our illegal drug supply. So it's really in all sorts of prescription drug medications that are obtained illegally. So in counterfeit pills, fentanyl can come in a powder. It can also be pressed into a pill. And the people who are manufacturing these have become so good at making those pills look exactly like legitimate pills. It's so hard to tell the difference. And so, teenagers, mostly older teenagers and young adults, could be fooled very easily by a pill that looks like, oh, it's just a Ritalin, it's just Adderall, it's no big deal, it's just an OxyContin, it's just a Xanax. No, it might contain even just a trace amount of fentanyl in it that could be really dangerous and deadly. And it is also appearing increasingly in the cocaine supply, which sounds like a very 1980s problem, but it's not, because it's very popular on college campuses, especially to use cocaine. So this is a significant problem for young people. So when we talk about fentanyl and fentanyl prevention with young people, most kids are not looking to take fentanyl. It's not really their goal. They understand at this point, most do, that it's deadly and it's dangerous, but it's not really what they're seeking out. They're seeking out these other substances. But it is unknowingly introduced into the substances that they are using, and that they may be getting from their friends over social media or from local dealers, and not really realize that that's what's in their supply. So in terms of why we are so worried about this, is since 2015, so about a decade ago, it is really that it has spiked tremendously in terms of how much we are seeing fentanyl in the drugs that are out there, these prescription drugs like opioids, benzodiazepines, stimulants, and other drugs. And what's really concerning is that overdose deaths among young kids, teenagers, 14 to 18-year-olds, has more than doubled over the course of a year, or even less than a year, between August 2019 and March 2020. And more recent data is showing that that is continuing to increase and get worse. And what's really important to note, back to what I said before, is that the vast majority of these are unintentional. The kids are not looking to harm themselves by taking fentanyl. It just happens to be in the drug supply. And we now know that drug overdoses are the third leading cause of death among young people, after firearms and motor vehicle crashes. And that does include pediatric deaths where a very young child takes it by accident. And again, here you could see just the chart of the increase in fatalities due to fentanyl over the course of a couple of years. It's been involved in 77% of the total number of overdose deaths in 2021, and that's a much higher rate than for other kinds of prescription substances. And I just want to share this one finding, which is, actually comes from a lot of research, but it's just, important to kind of think about, well, who's at risk for this? Which kids are most at risk of overdose related typically to fentanyl? And you'll find it among kids who are experimenting with substances who do not have any kind of opioid use disorder. They're not already addicted to heroin or other opioids or prescription opioids, but they may not be aware of the risk of fentanyl in their supply of drugs that they're choosing to use. Then there's the mental health angle. Kids who have mental illness or trauma who are looking for substances, including pills, to self-medicate, they're at higher risk of accessing these pills that may be laced with fentanyl. And kids who actually are using heroin or other opioids, OxyContin, Percocet, whatever, who have some tolerance to the opioid, and they may be seeking out fentanyl for a more intense high. So those are sort of the three key groups of kids who are at the highest risk, which is essentially, if you look closely, it's really any kid who touches a substance, unfortunately. And the reason it's so deadly and scary is because you just need a very, very tiny amount of fentanyl in order to cause a lethal overdose. And that is in this picture compared to the amount that you would have to take of heroin in order to experience the overdose. So it's really just takes very little, especially in a young person who is not used to taking any kind of opioid, who's considered naive to the drug, who will experience the overdose so easily. So now that I scared the hell out of you, I'm going to turn it back to Corey to kind of say, hey, here are things you can actually do to make the risk of this less likely for your child.
Yes, thanks, Linda, because there are things that we can do, and that's what we want to leave you with, that there are specific strategies that you can use as a parent to help with this. And so if you've been at one of our presentations before, you know that we love to show this. It's our 10 key protective parenting strategies. You can always refer back to this and learn more about these 10. But in terms of when it comes to what we're talking about today, a really important one that we want to bring back around is modeling. So modeling safe behavior with your own prescription drugs is really important. So that includes keeping your medication out of reach, properly disposing of medication that you no longer need. And again, that what Linda said about making sure that kids know that pills and medicine aren't necessarily the cures for everything and aren't always a good first option. You know, for aches and pains, we can model to kids that sometimes we try out using a hot bath or a cold compress first. For mental health challenges, we try out psychotherapy or cognitive behavioral therapy. That might be enough to help us overcome it. There doesn't always have to be a pill or medicine to solve our problems. And so, you know, some of these other ones, taking a health approach in all of our conversations, knowing what risk level we're dealing with and responding accordingly, starting these conversations early and not just once there's already a problem, and monitoring behavior, so on and so forth. It's important for parents to know the signs of prescription drug misuse. And not all of these are kind of specific to prescription drugs, but, you know, changes in mood or behavior, drowsiness, dizziness, slurred speech, loss of interest in academics or things that they used to like, lack of focus, poor attendance, low grades, conduct problems, disregard for rules, failure to fulfill their responsibilities. And, you know, this is might be difficult to notice. You know, teenagers might display a lot of these signs kind of naturally, but the important thing is just to notice if it's a marked change from their usual. And so being aware of these changes early can help you kind of intervene effectively. And we also want parents to be aware of social media as a source. You know, there's apps that are encrypted, things like Signal and WhatsApp, or apps where the messages disappear, things like Snapchat or having your Instagram messages on vanish mode. These are known ways that kids can buy and sell pills. So teens can get around these app rules because technically, you know, on these apps, it's illegal to buy and sell substances. And most of the time, drug-related language is censored on these apps, but you can use emojis and ever-evolving slang to kind of skirt around those rules. So those are the pictures we have here. You know, some of these are kind of more intuitive than others. Snowflake for cocaine, talking about going skiing sometimes is slang for cocaine. Leaves, green leaves for marijuana, or things like plug, being the plug or being the hookup is like you're the person with the substances and you're being the plug for others. So it's just important for parents to monitor social media use, be aware of how these social media apps work, and have constant, reliable conversations with teens about how selling, buying, or using substances offered or sold online is illegal and potentially dangerous. You know, there's always like potentially a friend of a friend that they're getting something from. They might think that they know what they're getting. They might think that they trust this person, but it's unrealistic to think that they can for sure tell what these pills are. There's just no quality control in a situation like this. And so some FAQ, things like a parent might say, you know, my kid was prescribed an opioid pain reliever after getting his tonsils removed, but since it's from a doctor, you know, I don't have anything to worry about, right? Like I remember I was 18 when I got my tonsils out and I got 30 hydrocodone pills to help deal with that pain. I certainly didn't need 30, but that was what I was prescribed. So parents, your antenna should go up. You should always be aware if your child is prescribed opioids. Parents should definitely, if you're worried about it, ask the doctor about non-opioid pain relief options. Let your doctor know of any family history of addiction or mental or behavioral health issues that might put your kid at higher risk than others. But absolutely keep track of how many pills were prescribed, keep track of when and how they're being used. Try to make sure that the least number of pills necessary are used. You don't want to be using these substances when you're not in pain. And then properly dispose of unused medication. So don't just leave, if you only use 5 out of those 30 pills, don't leave 25 hydrocodone just around and available for anyone to use. And so parents should feel empowered to have these kinds of conversations with their doctors. But also when these pills are in your house, just be aware and monitor their use. Should I be worried about marijuana-laced fentanyl? This is a question that I got recently. I was on a local news set recently and talking about opioids, and they went to people on the street and someone immediately was talking about marijuana-laced fentanyl. And so we wanted to make sure that people know that stories of fentanyl-laced marijuana have turned out to be false as of recent. Fentanyl is destroyed by an open flame. So things like marijuana in joints and blunts and cigarettes, fentanyl will be destroyed by smoking with a direct flame like that. So it's not a significant issue for things like that as of now, but it is a risk in powdered materials that will be snorted and injected. If I talk to my kids about test strips, which I'll get to in a second, but does that condone them using drugs, talking about harm reduction things? And so, talking to your child about test strips is not going to encourage them to use drugs, nor is it going to make your child think that using drugs is okay. Making sure that your child and all of the kids that are around you, their friends, know about test strips and know how to use them will help to keep them safe and can prevent an accidental overdose. It's like teaching your kid how to wear their seatbelt doesn't encourage them to get in a car crash. Teaching them stop, drop, and roll doesn't encourage them to set themselves on fire. It just lets them know what to do if they're ever in a situation that could be dangerous. So, you could easily say like using drugs is dangerous and ideally you're not doing this and no one is. However, if you are somewhere where people are using drugs, it's important that you know how to test them to make sure that they're safe. So talking about harm reduction, I'll go through this super quick. Harm reduction is the idea, it's a set of programs and approaches that's focused on reducing the negative consequences associated with substance use. And so this is things like supervised safe consumption sites, but we're going to be talking about test strips and Narcan. So determining if fentanyl is present in a drug. As we've talked about a lot, it's nearly impossible just looking at it to know if something is laced with fentanyl. There's no visual, scent, or taste difference. The only way to test it or to know is with testing strips. These are cheap, accessible, and fast. Basically, a tiny amount of the substance is dissolved in water. The test strip is put into that solution. You wait about 5 minutes. 1 line fentanyl, 2 lines no fentanyl. And so it's not going to test for a lot of other things that might be in substances, but if you're worried about fentanyl, this is something that can be used. And these can be purchased on a variety of different sites. You can buy them on Amazon, Dance Safe, and they're very cheap. And you can get them at some bars and some community organizations. So they are accessible and very useful. Talking about overdoses. So a sign of a opioid or fentanyl overdose. These are similar to other depressive overdoses, changes in pupil size, clammy skin, looking blue, having a blue tinge to the skin, difficulty breathing, coma, unresponsive. And so if you are in a situation where you think that someone is overdosing, what do? It's important to call 911 immediately, administer Narcan or naloxone, the other name for it, if it's available. Try to keep the person awake. If you give 1 dose of Narcan and that person is not responsive, after 3 minutes, you give them another dose of Narcan. And if you're not trained to use Narcan, it's very quick and it's very easy. But also while you're waiting, administer CPR, put the individual in the recovery position, so on their side with their hand underneath their head to avoid choking, remain calm and comforting. And a little bit more about naloxone. It's an opioid receptor agonist. So that just means that it will kick off the opioid on the opioid receptor in the brain and bind to it instead. So it quickly reverses the effects of an opioid and can save someone from dying of an overdose. Important thing to know if you're kind of in a situation and you're afraid to give Narcan because you don't know what it's going to do to somebody, there's no negative effect for giving Narcan to somebody that's not overdosing on an opioid. So there's, in a scary situation, there's really no harm in using Narcan because it doesn't do anything bad if the person's not overdosing. So it should be administered at any sign of an overdose. And all 50 states and DC allow naloxone to be purchased without a prescription, though it is differently priced across states. Again, reiterating the Good Samaritan law, this is in place to help people, protects bystanders and others who get help for someone who is overdosing or the person from experiencing an overdose, helping them to not be guilty or arrested in any situation. And then quickly going through our resources, you may have heard of some of these before. Our website has specific information if you're looking for more information on this topic about medication misuse, about fentanyl, about prescription drugs. And we have playbooks on how to have conversations about these things for preteens, teens. We also have support and resources, some of which are opioid specific. Opioid-specific personalized text messaging programs. We have an end overdose text messaging program, online support groups, trainings. Again, a substance use risk assessment tool. This is also available in Spanish that you can put in some of your risk factors and see kind of how worried you should be about either your use or your child's use. And specific resources for some minority populations, so LGBTQ youth. Yeah, and we have just a couple minutes left in case there's questions. And here's our contact information, but thank you so much for listening.
Thank you, Corey. Thank you, Linda. Do we have any questions? If so, please know that you can be unmuted or you can unmute yourselves. And if not, you can ask them in the chat. I know there was one that you already covered, Corey, about Narcan. So thank you for that. If we would love for you, if you have a moment, to please fill out the survey. Feedback is important. We want to make sure that these webinars are exactly what you need. And if you need a different topic, that we are able to fulfill that need in the near future. Also, just as a reminder, on January 31st, Wednesday, January 31st, Linda and Corey will be back speaking about the prevention of bullying and cyberbullying. So that as well will be available. And
Liza, can I just say one quick thing? If
course,
anyone does
Linda.
if anyone does think of a question tonight, tomorrow, next week, our contacts was on there, or you could find us pretty easily, and or anyone at Compass as well, and we'd be really happy to answer your individual questions at a later time.
Absolutely. And this recording will be on the Preferred's website, the Compass website. So please, you'll be able to find Linda and Corey's email and information there in case you didn't get a chance to grab it today. And Corey and Linda, if you want to put it in the chat as well, that would be great. In addition to that, if you have our information, Compass information, we will get you in touch with Linda and Corey. So whatever you need. Thank you, Linda. We're definitely here to support. There's Linda's information. And then can we go to the next slide? And there's our website information where you can find the recording. If you scan that, you can find the recording and all the recordings prior to this and any future ones on the website. And that is our phone number for additional information. So we want to thank everyone. And again, January 31st, we hope to see you. Invite a friend because this information is important and we want to share it as much as we can. So if we don't have any questions and answers, we're going to let you have a great, safe, and warm night. Thank you, everyone, for joining us. Thank
Thanks,
you,
Liza.
Linda. Thank you,
Thank
Courtney.
you. Have a nice night.
You too.